Good evening, everybody. We are back and we are live, and it's Sunday and it's 9 o'clock. And Mum is up in the hot chair. Woo-hoo.
Hi, how are you? So it's the winter time and it's a very rainy, horrible Sunday night, and we thought, what's everyone going to do? Come and listen to our rubbish banter and talk about some treatments. So what are we going to talk about tonight? Everybody that comes into me that is my age wants to do one thing, and they come in and they say to me, I just want to have this done. And I'm like, oh, okay. We all want that because it's this area here that we want to treat. This bitty here, the jowly bit.
It's a really unbonny look, that.
I know, it is an unbonny look, but it happens, because that's life. So, what can we do about this? We have surgery. Do we want to do that? No, we don't want to do surgery, so we have to look for an alternative. So, Dr. Q, what's our alternative?
So, what Mum neglected to say there is that actually, to show you all how we fix this, we've had to rope in our wonderful Dr. Q.
Hello.
And so Dr. Q is with us tonight. And he said hello already. So, yeah, he's going to tell us what we are going to do. And we've got loads of people coming to watch us already. So thank you so much for coming, because I know I've been a bit useless. This summer's been very hectic and we've been exceptionally busy.
Weddings, babies, graduations.
People don't know about weddings and babies. Well, everyone knows about weddings, but people don't know about babies.
Babies. Needy had another baby, who we will
did.
call Needy 2.
Needy the second. Needy the third. Ellie's so needy too.
So she's had another baby, and so she's been a bit busy, so we've not had the opportunity to do this.
She can't do it without me, guys. She can't do it without me. Although she says I'm needy, she's very needy herself.
I'm not the needy one. You know that you're the needy one.
She totally is.
So anyway, so we're back because it's winter time, and we thought it would be nice for us to have something rubbish to look at.
Except for when Celebrity Jungle comes on, I will change the times, because I do know that is an addiction, and it's mine too.
Okay, so what are we going to do, Dr. Q?
Right. See, the reason you get sort of jowls is with time you lose fat at the back of the face here, and the face comes forwards, and you get basically jowl forming, the nose to mouth line, and the mouth to chin line forming. So rather than filling these lines up, although that will make the line go away, but then you end up sort of being very puffy here, like a chipmunk look, which is not really good. So you're better basically pushing the face up the way. Now, to push the face up the way, you could do two things. I mean, you mentioned surgery, that's one thing. You could do threads, so you basically put about 6 threads in to lift the face up like that.
See, you need 6.
Yeah.
You're a hell of a droopy, you are, Jesus. Hi Sam, hi Jessica, hi Leanne, sorry.
Right.
Keep going.
Or you can basically put filler where the fat's been lost at the back of the face. So when you put a bit of filler around here, it pushes the face up a little bit like that. To correct this fully, you need to do a few more things. We need to push it up here, put a bit of filler in the cheek to lift it up, some in the sort of jaw angle to push this back further, and then some in this under the chin to push this forwards. So that would obviously take us some time to do. So today we're just going to demonstrate one of the procedures.
So sticky tape doesn't work then?
Not for long.
No.
It's a 24-hour fix, isn't it? You just pin it to the
Send
back of your neck.
What's that in facelift? When you put a ponytail on, Croydon facelift, isn't it? They call it when you pull your hair really tight or something like that.
Look, I was really good at that.
Today we're just going to sort of concentrate on this area, just as a demonstration. So we're going to put filler around this area to sort of lift the face back a little bit. Obviously there's other sort of areas that we can do, to improve it further, but we're just going to sort of demonstrate this for today. Threads are another sort of option as well. We're concentrating on fillers tonight.
It's because she's so droopy, isn't it? It's not because she's lost fat, so don't worry. He keeps talking about fat loss. She's had none of that.
I've had no fat loss, sadly.
Or maybe she has. It's just gone onto her arse instead.
Sure, so you sit back.
Okay,
So we're just going to clean the area first.
So what's this treatment called?
Right, so this is basically dermal filler. What we're using is Voluma. So dermal filler basically is hyaluronic acid, which basically binds to the skin's own hyaluronic acid and adds volume. to the skin. So you notice the difference straight away, but it can take up to 2 weeks for it to fully integrate with the skin and give you the sort of desired effect. So as you can see, if you come closer, you can see sort of some hollowing around here. Okay, so
Hollow.
Yeah, so it's not.
I knew she was always hollow. I knew that she was hollow.
I mean, it can occur when you sort of lose a lot of weight, but even just sort of normal sort of aging can sort of.
God, you're in a right joking mood tonight. Oh,
No,
this is
I've
it.
not lost any weight,
People are
sadly.
starting to feel mean. They're starting to feel sorry for you, obviously, because Christine O'Hara's just said, "Stop being so mean to her." You have no idea. She's brutal to me.
Brutal. I
Brutal.
don't think so.
You are so.
I don't think so.
But look, see, look, there's the arse.
No,
The arse has
no,
got bigger.
I know I've not lost a thing. Nick, not a thing. Roly poly.
See, honestly, you have no idea how many years I took it for, guys. So I am giving it.
Oh, she just likes to think she can get her own back.
Bloody right, I can. If we're on camera, she can't smack me. She can't hit me with
You're
stuff.
not allowed to smack anyone nowadays. It's ridiculous.
I feel protected.
I think all children
It's great.
should not like smacking. They definitely need it.
I feel protected. So,
Protected by what?
well, by the fact that I could probably thump you back
I
now.
can reach round it.
So we've got Louise and Kimberly and Jane and Alison watching. Thank you guys. Thank you all so much for coming to watch us and our crap banter. Well, I don't think it's that crap. I think my banter's actually pretty banging.
Oh, she thinks.
Mum, what's it you say to me all the time? Oh, something is not bestowing you or something. I don't know. She uses all these old-fashioned phrases because she's old.
Oh, self-praise is no
That's the
honour. Yeah, self-praise is no honour. It's so true.
Oh, Leanne says you have lovely cheekbones. They're fake. They're fake. They're all fake. She's done them. She's done them. That's it. They're fake.
They're my
See,
own.
you could all have these lovely cheekbones because they're fake. She's done them. Right. Your tooth filling is showing, so
I know,
stop doing
my
that.
tooth fell out.
Yeah, so
Exactly.
over this summer, she's managed to go out and lose her tooth, which was really helpful. Thank God it wasn't before the wedding. That would have been dreadful.
It would have been a bit ropey.
Right. Okay.
Okay, I don't really want to look. How big is the needle?
That's tiny.
That's just a puncture needle, really. So what we're going to use is a cannula.
No, honest to God, I swear down, Mum, that's a tiny one. Like, I'm not being funny.
All right, okay.
Yellow
here we
fever
go.
needle's much bigger than that.
Okay. Righty.
What kind of mascara are you using?
I'm just going to come on this side.
See how what's it look like?
A bit spidery.
Is it too spidery?
A little bit.
This
See, I
is
have to be
basically
honest.
a cannula, so it's a blunt needle, if you like. And so we made a puncture here. And then we basically,
That's very similar to what I had done.
yeah.
You actually do have quite good cheekbones.
Mm.
Do you know what's funny? You can see how the difference in colour tone of Mum's skin is from when she puts on the foundation, because of course she wears the double wear, at
No, I
least. Well, you've got full coverage.
I like full coverage.
Well, I was going to say you need it, but you actually don't. Your skin is not that bad. It's just not as brown as the rest of you.
No,
So
don't
she
tell
goes
me
on
face.
holiday.
Don't tell me face.
Well, I know, I'm going to tell everyone that. She goes on holiday and she sits by the pool the whole time and reads a book. And she will literally sit so long that her whole body will turn brown and her face will be white as a ghost. And then it's hilarious to watch because, of course, she's so white. So we're defining her face now because, of course, she's very undefined. I wasn't saying unrefined, I was saying undefined. I think that's right, because we're defining it. But you can totally see as it's coming up. And so what he did is he made just a small puncture with a tiny needle, teeny tiny. And then,
Yeah, I have to say that was okay.
there you go. Sarah Jack just asked, how painful is it?
No, it was okay.
And I have to say, my mum's a bit of a woos compared to me.
Oh, whatever.
See, she'll deny it to the hilt, but she's a woos compared to me because I am brave and I am strong and I'm a fighter. And yeah, if she doesn't think it's, I think anyone could do that.
See if you just sit up for me. Right, just look straight ahead.
I'm just gonna go in from here because you can see the definition that's created.
See if you just look straight ahead, just sort of head on.
I'ma come to you.
So the filler will take about 2 weeks to sort of fully integrate, as I said. So,
Yeah, you can.
So you can see a slight difference around here. What we would do next would be basically put some filler at the back of the face here to push this back.
Oh, that looks a lot less fucking droopy.
Yeah.
Don't swear at
Oops,
that.
sorry, but I couldn't believe how much it did. It does.
A little bit in the cheek, and then some in the sort of lower jaw, and that would basically correct the sort of whole jowl effect. But this is the area that we're sort of concentrating on today.
And so, if you were to correct the whole jowl area, would you do that all in one sitting, or could you do that over a course?
No, we usually normally do it in one sitting.
So you wouldn't be able to do, say, so see how we're doing the definition of the cheeks just now? You wouldn't be able to do that and then go back and do
no, you can do it all
the
in
chin?
one. You can do it in one go, or you could do it over a period of time. It's not really any sort of...
So it's not like you would literally come in and you would then be obliged to have the whole lot done.
No, you're not obliged to do it. I mean, if you want to do sort of get it done in one go, you can. If you want to sort of do it sort of over a period of months or weeks, then that's fine too. You know, you can even sort of add to it. For example, if you just had like a little bit done, and then if you feel sort of you need a bit more correction, then you can add to it. So it's not.
And will this create bruising? Is she going to look like she's been 10 rounds with Mike Tyson?
This is basically it. You know, so it'll just be a bit red, but that's just with the sort of rubbing and pressing. So there shouldn't really be anything else apart from that.
God, that's the most quiet Mum's ever been.
Yeah.
Ever.
Has it made a difference?
It bloody has, actually.
So if you
I think
check
you need to do this bit, though. That bit.
Do I need to do that now?
Well, I don't know if you need to do it now. I think that if you're going to do it, you may as well do it in the future.
We can do
But-
it sort of stages and then.
Yeah, but
Maybe what we'll do is we'll show again,
Do it.
and we can show that bit, because it does make a difference. It makes. Stop turning your head, because you keep turning your head in a weird way.
What way? That way?
No.
I
Just
don't
look
know.
straight at me so that they can see. Oh God, you need to change that mascara. It's so spidery.
I'm sorry.
Sorry.
I'll close my eyes.
That would be better, preferable. No, sorry, if I closed my eyes, then I wouldn't have to look at it.
That's true.
Thank you all, guys, so much for coming
What do
and
you
viewing
think?
us. There's so many.
What do you think?
Yeah, I think we need to do the other side, because you look a bit loppy.
Okay.
But it looks really good.
Does it?
Yeah,
Okay.
it's made a difference.
Okay. Good.
Hi, Nina. Hi, Louise. Hi, Rosalind. Hi, Sarah. Hi, I'm assuming Michelle is Michelle. Michelle. Oh my God, there's a lot of Michelles. Thank you all so much for coming to watch us. We really do appreciate it. And hopefully you can inspire us. But everyone's saying you've got lovely cheekbones. That's just lies.
Oh.
It's lies, guys. They're fake. They're fake. Can't tell you enough that it's all fake.
The other thing I want to demonstrate is to correct the jowl area, you do need to correct all these, the areas that I mentioned. So it needs about sort of 4 mil of filler. Usually people think, just like one syringe or 1 mil to correct everything. Then what happens is you just put tiny amounts everywhere and it doesn't really show. So you have to put, the right quantity in order to sort of achieve the effect. So if, for example, if you just took 1 mil and just put 0.2, it probably won't do anything. So we basically using 1 mil today, so half a mil on each side. What she would require next is basically about another 2 mils around this area and another sort of 1 mil around the sort of cheek area, so 4 mils in total to fully sort of correct. It all depends sort of how much of a correction you want and also how severe the problem is to start with.
Oh, you need to greatly correct her. Greatly correct. Nah, you're not looking that bad at the moment, Mum, I have to say. So,
Okay.
we've got quite a lot of people coming to watch us.
What do you think I need? How much more do you think I need, Charlotte?
What do you mean, how much more do I think you need?
How much correction do I think have I had?
No, well, I think sometimes, now, I'll be honest, sometimes you go OTT with the lips, and
Just one.
that was not a good look. It was not a good look at all. But as I say, you know, I am brutal with my mother, and I will tell her the truth. I do think sometimes she has had in the past a tendency to maybe do too much in the lips. I do think the sculpting of the face is actually very beneficial, and I think it's well worth doing, especially if you have been through certain things. Like, I noticed a huge difference with mine. Mine looked incredibly so much better, because I was looking a bit like a junkie for a bit there. I shouldn't say that, should I? But you know, I wasn't looking great just because I'd had such a dramatic weight loss. But I do think that a small amount of maintenance is always a good thing, but not too much. But I do think that the only time that I think you've ever done too much was when you did your lips that ridiculously big and you looked like Jordan for a week. I did it.
Just because you get a bit of swelling with the lips anyway.
I know.
They always swell, first of all. You have to expect.
That was
to get a bit
ages
of
ago, though.
It was about a year. It's lasted really well, so.
But that's it. So how often do you have to get this done? Like, realistically, how long does it last for?
At least around 12 months or so. Some people can get a bit longer, about 18 months. Some people get a bit shorter, about 9 months. Depends how your body's at breaking it down. But on average, I would say about sort of 12 months.
So realistically, it's quite a small investment for looking hot for a year.
You won't sort of do the whole thing again. I mean, you would basically just maintain
Top
it.
it up.
Yeah.
Mm-hmm.
So if you were to do the whole lot, you would maybe have a small outlay, and then the outlays would be smaller and smaller every year because you're just topping it up.
Yeah, because I mean, when you're doing it for the first time, you've never had anything done before, then it's basically you're putting a lot in. First time round. But you won't put the same amount in every time, you know.
So maybe next month we'll do the bottom bit.
Yeah, so I think what we'll do is we take pictures of this, how it is now, and see how it is in a month's time, and then we do the sort of second bit.
Okay.
And over this next month, while we monitor this, which we will, guys, and we will, I'll put up some pictures. I'll be a bit more on it, or at least I'll try to be. We'll put up some pictures as her face is progressing, shall we say. How much difference would we see between the start of the month and the end of the month, do you think?
So it should, what it is just now, it should improve, let's say, maybe another sort of 40% or so.
See, so that's basically half again, isn't it?
And
Oh my God, by Christmas you're going to be looking hot, Mum.
Right, and then next time you can basically just do this area and basically the lower jaw really. So we'll put basically 1 mil on each side.
And so just in case anybody is interested in coming and chatting with Dr. Q, he does have limited spaces available for tomorrow, which would mean that you'd be a hottie patottie for Christmas Day, which, you know, of course we all want to be, to sit in our houses or you know, well, we sit in our house in a fancy dress, don't we? How sad is that? You get dressed up to go downstairs.
Everyone does that for Christmas Day.
Well, of course you do.
So we're also looking for models for over the next couple of weeks. So if you've got something that you want to address, you want to take some bits off you, or maybe a chemical peel, or improve your skin, or anything like that, we will be back next week doing some other treatments for. But we have to decide which ones we're going to do, and I'm hoping that at some stage, maybe Charlotte might get that big needle again.
Joe has put a definite no to it. So
I think she should. So anyway, Dr. Q is here with us tomorrow, and if anyone wants to discuss anything, they can give the phone or come in and see him.
I mean, we only do have limited spaces, so it really is, unfortunately, we're getting really full for Christmas for this month and next month, but certainly give us a shout. Also, if you've got something interesting, like, you know, like, I don't know, if you've got a port wine stain or something amazing that not everybody has, that we might be able to help you with, please, please, please email me or Facebook me. You can do it on my private message, you can do it on Mum's, or you can do it on our Fantasia page, or come in and see me. My banter is epic, by the way, so get used to it. Right.
So, thank you so much for coming to watch us, and thanks Dr. Q for coming to do some treatments on me. It was fine, there was no pain, it was easy peasy, lemon squeezy.
Right, hang on, I'll just take you round to the front of Mum's face. Yeah, look, it looks so much better.
Does it? Oh,
Yeah, it looks so much better. You do need to change that mascara though.
Okay.
Right, guys, thank you so much for coming to see us. We really appreciate it. And I can't wait to see you all next Sunday, 9 o'clock.
We will be live again. Thank you so much.
We'll probably be on our own, though. We can't rope poor Dr. Q in every week. So we'll see you next week. Bye, guys.
Okay, bye-bye.